Okay, I wanted to thank one of my patients who basically put this up on YouTube. We used to give everyone a copy of their videos to put up on YouTube. I guess you could ask for it if you want. Okay, so this is a ring. I'm putting the alcohol solution in. I'm holding it down firmly. The guy's blinking, but it's not leaking because I'm holding it firmly. It's a good Lasek, by the way. So this is basically using alcohol to get rid of the epithelium. I helped invent this when I was at Harvard with Doctors Talamo and Abad. We published the paper. Now I'm using the Wexel or cellulose sponge to take off the alcohol. And the next step is very important. See the trephination? I'm basically rotating the edge of it, and you can see there's a little dent there to separate. It's like to start the edge. It's basically, I invented this sharp thing that the manufacturer now sells that is a sharp ring to get a good trephination, or is basically getting a good initial start. And you can see the way I'm holding the spatula. This is a blunt spatula, but I'm kind of doing it in some circumlinear fashion, which is tangential. I guess in layman's talk, I'm just trying to do it in a fashion that it's now a perfect circle. You can see it's a great, great Lasek. It basically looks like an epi-Lasek at the end because the edges are so clean. I'm just using a sponge to get rid of the water so it doesn't block the laser. But the main point is if you look at the edges and they're clean, that's going to be a quick regrowth, quick recovery, no pain, no inflammation, no scarring. If it's all jaggedy and stuff like that, it's gonna hurt. It's gonna take forever. It's gonna maybe scar because of the inflammation. So just to summarize, a PRK manually with the amoyless brush, almost nobody does anymore because it's really traumatic and can cause residual epithelium. We narrated one of these things where the guy had a bad ablation afterwards and irregular astigmatism induced by the laser because there was some epithelium blocking the laser. You can take it off with alcohol. If you do a good job, it looks like this. It's a Lasek. I've done about 10,000 of these, so one would think after 10,000 I'm pretty good at it. There are other people who don't do this very frequently. It's one of the reasons we tell people not to go to a LASIK surgeon for a Lasek or PRK because, obviously if you do this thing once a month, or maybe once a quarter, it's a little different than if you do it several times a day. And this is basically just the laser part, which is the same for all the procedures. So in summary, PRK is traumatic, it hurts, it takes long to recover, it might scar, you can only up to maybe -6. A proper Lasek is using alcohol and you have a good edge. If you have a bad Lasek, it's basically like a PRK again. If you have a good Lasek, it almost looks like an epi. Look at the edges. The edges here are amazing. I mean, these are like A+ edges. If you showed this to any surgeon, they'd be like, oh my God, I can't believe the edges you got. Now look, this is another point. We're applying mitomycin C with a sponge. This is a high prescription. If you have a surgeon who says, oh, you have a high prescription, you can't get PRK because you're going to scar, they're not using mitomycin C. So mitomycin C is an antimetabolite that's from cancer chemotherapy. We published a paper about this a couple of years ago in ophthalmology with one of my MD PhD fellows, Dr. Bakeva, and it shows that if you use mitomycin C after the ablation or laser application, just for like 30 seconds to prevent scarring. So with this, we can go up to -20. We've actually lasered the highest prescription in the world successfully without any scarring at all at Park Avenue Lasek, and that's with the surface ablation Lasek technique plus mitomycin C. Now I'm just basically moving it around to make sure I cover the whole bladed surface so it doesn't scar, and then I'm just going to rinse it off with BSS or saline solution. Anyway, hopefully these videos are helpful. I want to thank the patient for posting this on YouTube. And if you look at the YouTube videos, this is the bandage contact lens, helps the skin grow back in a few days. If you look on YouTube and you look up Lasek, I think half of these videos are actually my patients putting them up. And this is just a steroid job to prevent infection. Okay, thanks a lot.